Hello, everyone. My name is Jean Tiberio, and I'm a nutritionist and a wellness coach. Welcome to Healing Outside the Box. What we have here is episode 121, and it's an update or a sequel to a podcast episode I did a few years back on interpreting your nutrition-related lab tests. Now, every once in a while, I like to tell people what on earth I think I'm doing with this podcast. Well, here's what I think I'm doing. I like to poke around on the World Wide Web, and I listen to nutrition topics in the news, in documentaries, in books, and I give you my take on what the sciencey guys are saying and what it might all mean to us. My focus is on nutrition, since that happens to be my field, but I also look into other ways to help us eat healthier and feel better. So today I'll be talking about how to understand a nutrition-related lab tests. In other words, what they mean, and maybe what it means to you. Now, we certainly don't think this is a replacement for the medical care that you now get with your doctor or your doctor's opinion. My purpose here is to basically spark your curiosity, so hopefully you are interested in learning more and feel free to ask questions of your doctor. So as I said, about 2 years ago, I did a similar podcast, and I brought up the fact that there was a new tech item on the market, and this little patch could test your blood sugars and scan them into your electronic device. It's called the Freestyle Libre. This is now being advertised on TV, but it's just available for insulin-dependent diabetics. That may change, but as of April 2019, that is the case. Now, over the past 2 years, this Freestyle Libre has been checked against fingerstick blood sugars, and it has been found to be pretty accurate. So you may want to look into that if you're an insulin-dependent diabetic. Check with your doctor for details because you'll definitely need a prescription. I made a bunch of phone calls and wrote to the company to see if I could get my hands on one of these, but so far I haven't had much luck. If this testing device takes hold, it will give you and your doctor more accurate information that will help everyone treat their type 1 and type 2 diabetes much better, with fewer side effects. Technically, down the road, it could help people with prediabetes maybe prevent the progression into diabetes. And, dare I say it, possibly it could prevent everyone from getting the complications of progressing diabetes. By the way, the new guesstimates in terms of future cases go something like this. In the next decade, there may be as many as 50 to 70 million diabetics. That's a whole bunch of crazy right there. So as I said, I'm trying to get my hands on one of these devices, and I'll let you know my honest opinion about it when I do. Okay, so now you're in your doctor's office, wearing your hospital gown with that embarrassing opening in the back, all drafty and all, and your doctor is reviewing your lab tests with you. Wouldn't you like to know what the heck he's talking about? Well, those strange numbers can be a little overwhelming when you're sitting there in your hospital gown with the breeze in the back, feeling very vulnerable. But it doesn't have to be that way. Today we're going to discuss some basic groupings of the lab tests, what they are, their normal ranges, and what it may mean if some of these are out of the normal range. This will not turn you into an expert, and quite frankly, I'm not much of an expert myself, but it may help you to feel more comfortable just talking about these lab tests with your doctor. And again, this is not meant to be a substitute for good medical care. You should be going to your doctor for that. But it may help you feel armed with enough information to be participating in your own care. Because if you're more interested in the subject, and the subject being you might just be better off all around. And maybe it will make you feel more comfortable discussing it if you get less than perfect results. I'll also put a list of some of these common labs and their normal ranges in the show notes, and that's on my webpage, healingoutsidethebox.com. Now, while we're discussing diabetes, your doctor may test your sugar either in your blood or in your urine. And that's because sugar, if it's high enough, will spill into the urine from the blood. A blood sugar is almost always included in a typical screening panel, which is often called a Chem 13 or a Chem 20, or whatever they're calling it. More than likely, with a screening panel, you would have at least had breakfast, so it will not be a fasting sugar. Now, for a blood sugar, the usual cutoff for normal is 140. Again, this is after you've eaten. But I've seen 160 being described as normal. If you already have diabetes, your doctor may accept 180 as normal. But in my opinion, this should be tighter control to avoid side effects altogether. So what I'm saying here is that there is some disagreement about what is ideal versus what is acceptable. Now, if your screening blood sugar seems high, your doctor will probably take a fasting blood sugar. A fasting blood sugar of, say, 65 to 100 would be considered normal. 110 may also be considered normal, but it's skirting with the upper limit. If the fasting blood sugar is above 110, most physicians would consider that borderline or prediabetes. Now, as for gestational diabetes or diabetes during pregnancy, usually this test is done at 24 weeks pregnancy. This could be called a glucose tolerance test. You first have your blood sugar taken while fasting, then you drink a lovely syrupy solution and have your blood sugar taken at 1 hour intervals for 3 or 4 hours. If you're diagnosed with gestational diabetes, you will be treated with strict medical supervision. And that is, of course, to prevent any serious complications. Your OBGYN may also put you on insulin if your sugars cannot be controlled with diet alone. This is because abnormally high blood sugars during the remaining 16 weeks of pregnancy could result in adverse effects to the unborn child. Now, I've been told that about 50% of gestational diabetics will see their blood sugars return to normal after giving birth, only to develop diabetes later on in life. It's possible that that number is more than 50% now because of the rising rates in diabetes in the general population. If you watch any TV whatsoever, you may see ads for diabetic drugs. There's often a lovely couple, and they're walking through the field or in a sailboat, looking very happy. The voiceover guy may mention something called an A1C, which is a glycosylated hemoglobin. Normal A1C values are generally in the range of 4.3 to 6.1. This is thought to measure an average of blood sugar levels over the last 90 days. It doesn't seem to make sense that this would be accurate, but it does give the doctor a pretty good idea of how your blood sugars have been trending over those last 3 months. And this can serve as a guideline for your doctor when he prescribes doses of oral meds or insulin. But it's certainly not the best way to run a preventative control of your blood sugars. The best way is to monitor your blood sugar as you go along. Diabetics are usually given a prescription for a glucose monitor so they can check their blood sugars with a finger stick. The type 1 diabetics will be asked to check their sugar 3 to 4 times a day. With type 1 diabetes, their doctors will want their blood sugars in tighter control to avoid the horrible complications of uncontrolled diabetes. A gadget like the Freestyle Libre would make a huge difference because it can give you your blood glucose levels all day long, and it allows you to see what foods will raise your blood sugar to what extent. Now, this might be a good time to go over the symptoms of low blood sugar, or hypoglycemia, and high blood sugar, hyperglycemia. Symptoms of low blood sugar, or a blood sugar of less than 65, will be sweating, which is sometimes referred to as clamminess or diaphoresis, also shakiness, rapid heartbeat, anxiety, and eventually coma. This is a risk that type 1 diabetics have to live with, but this type of low blood sugar is almost never seen on the common oral medications like metformin. Symptoms of high blood sugar, which is more common, include extreme thirst, fatigue, not the type of fatigue you get after you enjoy watching Netflix the night before, but I can't hold my head up fatigue. Also weight loss. That would be if the sugar gets too high in the blood and spills into the urine. Frequent urination, blurred vision, trouble concentrating, or a foggy headedness, and headaches. One person who was diagnosed with diabetes that I was seeing told me that he felt like he could drink a garden hose. This is not a typical thirst that you might get on a hot summer day. Women with chronically high blood sugars may get yeast infections or frequent UTIs. If a urinalysis is done, the urine should be clear and free of glucose and ketones. If the urine has glucose or ketones, suspect diabetes. Here's why the ketones are there. Insulin's job is to take the sugar or the glucose in your blood and bring it to the cells to be used, your muscle cells, skin cells, etc. If that is not happening and glucose is building up in your blood, there is no glucose for your muscle cells to use. Fat will be burned furiously and will produce ketones. Ketones are a byproduct that happens because so much fat is being used for energy that the fat-burning mechanism is running to capacity. So ketones will then be used for energy by the brain and other cells. Now, the urinalysis will say whether the urine is clear or cloudy. A cloudy urine may imply a possible infection. An amber color urine may imply severe dehydration. The pH of the urine should be in the neutral range, about 7, and there should be no protein in the urine. Okay, so let's go back to the screening panels. Your doctor may do something like a Chem 13 or a Chem 20 panel. This will include potassium, which should be less than 5. If your potassium, chloride, or sodium are high, you might just be a little dehydrated, which wouldn't be unusual if you were coming to your doctor with, say, a gastrointestinal illness. But if it's very high, your doctor may check other things. Now, this chem panel may include a carbon dioxide. Usually, it should be less than 32. A high carbon dioxide might mean that, for whatever reason, you're not exhaling sufficiently. Now, I happen to have a problem with CO2 exhalation because I have a rare form of muscular dystrophy called hereditary inclusion body myopathy, which means that my lung tissue is fine, but my breathing muscles are weak, so my muscles can't push out the carbon dioxide. You might also have a high CO2 if you have COPD, or chronic obstructive pulmonary disease. Now next you have your BUN, or blood urea nitrogen. This test is done usually with a creatinine test. Normal values are generally less than 20 for your BUN. Now, if your BUN is high and your creatinine is normal, you might just be a little dehydrated. If both your BUN and creatinine are high, you might be having a situation with your kidneys. Obviously, your doctor will talk to you if that is the case. A creatinine of greater than 2.0 will require further testing, more than likely. Now, rounding out the Chem 20, we have albumin, which is a test for protein in the blood. Normal is about 3.5 or above. Then we have magnesium, and then something called liver function tests. Liver function tests are generally measuring enzymes in the liver. Now, alcoholics or people that use recreational drugs on a regular basis may have high liver function enzymes. Liver function tests can be monitored when patients are on certain medications as well. You should always check with your doctor if you're wondering why your liver function tests are being monitored. Next, we have a CBC panel, which is screening for infections usually. This includes your white blood cell count, or WBC, which should be less than 11. This panel will include iron testing in the form of hemoglobin and hematocrit. These iron levels may drop, say, after surgery, but that is quite normal. Your hemoglobin and hematocrit might drop during pregnancy, but that is, again, quite normal. Next, we have our lipid panel, where our cholesterol level is taken. It may say on your lab sheet that an ideal total cholesterol level is less than 200, but again, that might be up for interpretation. I worked for a bunch of 5 cardiologists, and there was some disagreement even among them as to what is really ideal. One of them liked to shoot for a level of 150 in his patients, and he wanted to put his patients on vegetarian diets. Some were game, and some maybe not so much. Another one used to say that a cholesterol range of 200 to 240 will not be a good predictor of who might or might not get a heart attack. There are always other factors to consider. I discussed these lipid test results in another podcast, and I'll give you a link to it in the show notes. But within this lipid panel, you have your HDL, or good cholesterol, which ideally should be as close to 60 as possible. 40 to 60 is given as the normal range. This is a high-density lipoprotein fraction, and it functions to control the cholesterol in your blood, which is a good thing. So that's where you want your cholesterol to be. The LDL, on the other hand, is the opposite. It is associated with the plaque on the artery. The lower the better. An ideal level is about 90, or as close to that as you can get. And most doctors will admit that that is pretty hard to achieve on a typical American diet. There's another marker for risk of heart disease, and it's called homocysteine. Now, homocysteine is technically an amino acid that is actually produced from another amino acid called methionine. An elevated homocysteine level is considered an independent risk factor for both plaque accumulation on your artery and clots. What is a normal level? Well, doctors like to shoot for 15 or lower. So a level of 15 to 30 they might consider moderately high. And anything greater than 100 is considered a severe elevation. Anyone with a high homocysteine level will more than likely be prescribed a meat-free diet. So why do we need cholesterol anyway? As it turns out, it does have some functions in our body, and one of them is to transport fat-soluble vitamins through our body to where they are needed. Fat-soluble vitamins are, well, fat-soluble. So they will need help being transported around the bloodstream, which is water-soluble. So these lipoprotein fractions have some fat and some water-soluble substances, so they form a ball so they can be carried through the bloodstream. Next on your lipid panel is your triglyceride level. This should be less than 150. Triglycerides are literally the storage form of fat in your body. It's basically 3 fatty acids that are stacked together. Triglycerides tend to be higher in type 2 diabetes because diabetes alters normal fat metabolism. In addition to your labs, your doctor may do an EKG. This will also measure your blood pressure and your heart rate. 140/90 is the cutoff point, but basically the lower the better. Your EKG should obviously be discussed with your physician privately. While we're on the subject, the diet-related risk factors for heart disease are, number 1, an unhealthy diet. What a surprise. High blood pressure, high blood cholesterol, diabetes, smoking, being male because of the testosterone level, being overweight, also the factors we can't have too much control over, which are family history of heart disease, psychological stress, well actually we do have control over that, and age. The other diet-related thing I want to mention is that with long-term diabetes or morbid obesity, you may start to see these liver function tests rise a little over time, but I never think that's a done deal. They've even put elderly people on low-fat, Mediterranean-type diets and seen these levels all go down. Now, obviously, if you have any specific questions about your labs, don't be afraid to ask your doctor. Their job is to help you understand these labs so you can feel more comfortable with the results as they come in. Now, that's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.